need you to stop what you're doing and listen to me very closely for the next few minutes. I am not trying to scare you, but I need to share a statistic that absolutely terrifies me, and it should concern you too if you are dealing with any kind of lower body pain. According to a comprehensive analysis published in the Journal of Pain Research, nearly 40% of patients who undergo back surgery specifically for lumbar pain still experience significant pain after the operation. Think about that number. That is almost half. That means nearly 1 out of every 2 people who go through the immense stress of surgery, the risks of anesthesia, the agony of recovery, and the months of rehabilitation come out the other side with the exact same problem they started with. Why does this tragedy happen? It isn't because the surgeons are bad at their jobs. It isn't because the hospitals are incompetent. It happens because of a fundamental case of mistaken identity. Millions of people are treating their backs when the real criminal, the true source of their misery, is actually their hip. They are treating the smoke and completely ignoring the fire. You see, your lower back and your hip joint are like 2 bad neighbors living in a duplex with paper-thin walls. They are constantly shouting over the fence at each other. When one gets irritated, the other one starts screaming. The pain signals they send to your brain are almost identical. A pinched nerve in your L4 or L5 vertebrae can feel exactly like a rotten, grinding hip joint. And conversely, a stiff arthritic hip can force your pelvis to tilt, causing your back muscles to spasm so violently that you become convinced your spine is crumbling. If you treat the wrong one, you are not just wasting your time and your money, you are letting the real problem rot. While you are doing back stretches and taking nerve medication, your hip arthritis is quietly chewing away at the cartilage, bone on bone, getting worse by the day. By the time you finally figure it out, the damage is double what it was when you started. But you do not have to be a statistic. You do not have to guess. There is a hidden language your body is using to tell you exactly what is wrong. I call it the Groin Rule, and it is the single most effective way to tell the difference in seconds. But it gets tricky. There is a specific mixed signal called the C sign that fools even experienced doctors. If you have this specific pain pattern, you are in the danger zone for misdiagnosis. Later in this video, I am going to walk you through a specific bed test, a definitive tiebreaker that I use to solve this riddle with 100% accuracy. You absolutely need to know the bed test before you agree to any injections or procedures. But first, we have to start with the most obvious clue that is literally right at your fingertips. Let's get straight to the diagnostic. You don't need an MRI, an X-ray, or a referral slip for this first clue. You just need your hand and a little bit of focus. I want you to stop thinking about the pain as a general cloud of misery and start thinking about exactly where it lives. I want you to find ground zero. Take your thumb. I want you to physically place your thumb right on the spot that hurts the most. Don't just point at it, press on it. Commit to the location. Now look at where your thumb is. Is it reaching around to your back pocket? Is it sitting on the fleshy part of your buttocks or just above your belt line on the back? If your thumb is on the posterior side, the back side of your body, that is usually the lumbar spine. That is your back talking to you. But, and this is the big distinction that people miss, is your thumb in the front. I'm not talking about the side of your leg. I'm talking about that deep diagonal fold where your leg meets your pelvis. The crease of your pant leg that appears when you sit down. That is your groin. If your thumb is digging in there, deep into that crease, that is your hip joint. People get this wrong constantly because of a massive misconception about anatomy. We grow up thinking the hips are on the side. You know, when you put your hands on your hips to look stern or tired. You are actually putting your hands on the iliac crest, which is just the upper rim of the pelvic bone. That is not the joint. That is just the rim of the bowl. The true hip joint, the ball and socket, the mechanical bearing that moves your leg, lives deep in the front. It is buried under layers of thick muscle and tissue in the groin. It doesn't live in your back pocket. Research from the American Academy of Orthopedic Surgeons confirms that over 90% of true hip joint pathology presents as groin pain. If you have pain in the buttock, there is a very high chance it is referred pain from the spine. But if the pain is in the groin, it is the hip until proven otherwise. I want you to sit down in a firm chair right now. Find the crease where your thigh creates an angle with your torso. Press your thumb firmly into that crease, right in the middle. If that spot is tender, or if it aches with a deep, dull throb like a toothache inside your leg, that is the groin clue. That is your hip screaming for help. Now, I know what some of you are thinking. You're sitting there saying, but wait, it hurts in both places. I have the ache in the front, but I also have the sharp catch in the back. You are dealing with a mixed signal. This is what we call the C sign, and it is notorious for fooling even the best clinicians. Imagine taking your hand and making the letter C with your index finger and thumb. Now cup that C over the side of your hip, just above the bone. Your thumb is digging into your lower back, and your fingers are gripping into your groin. You are literally holding the entire problem area. This is where it gets incredibly tricky. This specific pain pattern is a master of disguise. It mimics a pinched nerve perfectly, but it can also be a sign that the hip is so stiff and locked up that it is physically twisting your spine every time you take a step. When you have the C sign, you are in a gray area. You are in the danger zone of misdiagnosis. You need a tiebreaker. You need a way to force the body to confess which part is the real culprit and which one is just the victim. There is a specific test you can do lying down, the bed test I mentioned earlier, that solves this riddle. It isolates the movement so the liar can't hide. It is the gold standard for home testing because it separates the mechanics of the hip from the mechanics of the spine. I am going to walk you through that test in just a minute so you can be sure. But before you get on the floor, I want you to check your morning routine. The answer might actually be hiding in your shoes. I want you to mentally replay your morning routine today. Specifically, I want you to think about the moment you put on your socks and shoes. This seemingly simple task is actually the ultimate battle between mobility and stability. It is a stress test for your lower body that tells us more than an X-ray often can. When you go to put on a sock, do you have to physically wrestle your leg up? Think about the mechanics. To put a sock on your left foot, you usually have to lift the left leg and cross the ankle over the right knee. This requires a movement called external rotation. Your hip ball has to spin outward in the socket. If you try to cross your ankle over your opposite knee, what happens? If you feel like your leg is stuck in cement or you get a deep blocking pain in the groin that physically stops the movement halfway, that is a hip capsule issue. The ball is rusted inside the socket. You have lost the mechanical ability to rotate. That is a bone and joint problem. It is a mechanical failure. However, if you can move the leg, if you have the flexibility to get the foot up there, but the moment you lean forward to pull the sock up, you get a sharp electric zap shooting down the back of your leg, that is the spine. That is a nerve getting pinched because you are stretching the spinal cord. The rule is simple. Mechanical stiffness usually equals hip. Electric shocks usually equal back. Think about the implications of this. If you cannot tie your shoes without pain, you are losing your independence. It starts with shoes, then it becomes toenail clipping, and eventually it affects your ability to get in and out of a car. A study from the Journal of Geriatric Physical Therapy showed that loss of hip rotation is one of the leading predictors of falls in seniors. This isn't just about comfort, it is about safety. Now, let's take a trip to the grocery store. This is one of the most revealing environments for your spine because it forces you to walk for an extended period while holding on to something. I want you to visualize yourself pushing a shopping cart down the aisle. Watch how you walk when you are pushing the cart. Do you find yourself leaning heavily on the handle? Do you slump forward over the kale and apples, almost resting your chest on the bar? There is a physiological reason you do that, and it isn't just because you are tired. When you lean forward, you are putting your spine into flexion. This physically opens up the spinal canal and the small holes on the side of the spine called the foramina. It makes the space where the nerves live slightly bigger. It relieves the pressure. If you lean on the cart and your pain magically vanishes or gets significantly better, that is almost certainly your back. That is classic spinal stenosis. Stenosis is just a fancy word for narrowing. As we age, the spinal canal gets tighter. When you stand up straight, it closes like a vice. When you lean forward, it opens up. Your body is smart. It found a position that stops the pinching, so it keeps you there. But here is the kicker. Leaning forward does nothing for a rotten hip. If you lean on the cart and that deep toothache-style pain in the groin is still grinding away, it's not your back. The hip bears weight regardless of whether you are upright or leaning. The cart can mask nerve pain, but it cannot hide hip arthritis. The grinding happens as long as you are standing on the leg. Next time you are pushing a cart or using a walker, pay close attention to the sensation. Does the relief come from the support and the leaning, or does the pain stay exactly the same no matter how you stand? If the pain is stubborn and constant, look at the hip. If the pain vanishes when you slump, look at the back. This simple observation can save you months of treating the wrong area. We need to talk about how far the pain travels. Pain is a traveler, but different problems have different passports. True hip joint pain is usually local. It likes to stay close to home. It grinds in the groin, it radiates to the side of the buttock, and it might ache halfway down the front of the thigh. But hip pain almost always hits a wall at the knee. It rarely goes below the kneecap. It hits that barrier and stops dead. Why? Because the nerves that serve the hip joint, the obturator and femoral nerves, don't really extend their pain signals much further than that in this context. However, if your pain shoots past the knee, travels into the calf muscle, wraps around the shin, or makes your big toe tingle, that is a long-distance traveler. That is a nerve root in your lower back, specifically the sciatic nerve. The hip hurts locally. The back hurts distally, far away. Think of it this way. A hip problem is like a rusty hinge. It grinds right where the door opens. A back problem is like a short circuit in the wall. It blows out the light bulb in a completely different room, your foot. If the pain is in the calf, it's the wiring, not the hinge. The Mayo Clinic states that sciatica is the hallmark of nerve root irritation. If you have pain that traces a line down your leg like a lightning bolt, you are dealing with a wiring issue. The hip joint cannot send pain signals to your ankle. Only the sciatic nerve can do that. So, look at the map of your pain. If it stays upstairs, think hip. If it travels downstairs to the foot, think back. It is a simple boundary line, but it saves people from getting the wrong treatment every single day. Okay, remember that confusing C sign we talked about earlier, where you hurt in the front and the back and you don't know which is which? It is time to solve that mystery with the bed test. This is the tiebreaker I promised you. This is how we isolate the variable. I want you to lie flat on your back on a bed or a comfortable spot on the floor. Relax your legs completely. Now, take your hands and grab one knee, the one on the painful side. Pull that knee up toward your chest. Pull it as far as it will comfortably go. Pay attention to exactly what you feel. Don't rush this. Close your eyes and feel the mechanics inside your body. If you feel a pinching, blocking pain in the front groin, like something is getting jammed or caught in a door hinge, that is hip impingement or arthritis. You are physically smashing the irritated ball into the damaged socket. The pain will be sharp and deep in the front crease. This is a positive test for hip pathology. But if you pull the knee up and you feel a tight pulling sensation in your buttock or a sharp shooter going down the back of your leg, that is your back. Here is why. Pulling the knee to the chest flexes the spine and stretches the sciatic nerve. If the spine is the problem, the nerves will protest against the stretch. If the hip is the problem, the groin will pinch against the compression. This test isolates the joint compression from the spine stretch. It separates the two neighbors so you can see who is really shouting. If you perform this test and feel that pinch in the groin, you have your answer. It is the hip. If you feel the stretch in the back or the zap in the leg, it is the spine. Now that we have identified the culprit, we need to talk about how to start fixing it immediately, safely, and from the comfort of your own home. If you failed the groin test or the bed test, and we are pretty sure it is your hip, you need to be very careful with what you do next. The worst thing you can do for a stiff arthritic hip is force it into a heavy static stretch. You don't need stretching. You need lubrication. You need to feed the joint. I want you to try the windshield wiper. This is not just a stretch, it is a feeding mechanism for your cartilage. Lie on your back on your bed or the floor. Bend your knees so your feet are flat on the surface, but place your feet wider than your shoulders. This wide stance is critical because it changes the angle of the femur in the socket. Now, gently let both knees drop to the left, then gently drop them to the right. Just like the wipers on a car in a slow rain. Do not push it to the floor. Do not force the range of motion. Just let gravity do the work. This internal and external rotation moves the ball inside the socket without grinding it under your body weight. Here is the science behind why this works. Your hip joint has no blood supply of its own. It relies on synovial fluid to bring oxygen and nutrients to the cartilage. But that fluid only moves when you move. It works like a sponge. When you compress and release the joint gently, you pump fresh fluid in and push waste products out. This is called imbibition. When you do the windshield wiper, you are effectively washing the joint with nutrients. It flushes out the inflammatory debris and brings in fresh oxygen. It is like an oil change for your hip. Stop immediately if you feel a sharp pinch in the groin. If you have had a total hip replacement, talk to your clinician before doing any rotation exercises, as there are specific restrictions for you. But for most people with osteoarthritis, this gentle motion is the key to waking up without stiffness. Now, let's flip the script. What if the shopping cart test and the bed test proved it is your back? If leaning forward felt good, it means your spine is craving space. Gravity is crushing your discs all day long. We need to open those holes up safely and give your nerves a break. I want you to try a seated decompression. This is a safe way to mimic the effects of a traction table without the expensive equipment. Sit in a sturdy chair with armrests. It must be stable, no wheels. Place your hands firmly on the armrests. Keep your feet flat on the floor. Now, slowly push down with your hands to lift your body weight slightly off the seat. You aren't trying to do a dip. You aren't trying to build tricep muscles. You are just trying to take the load of your torso off your lumbar spine. Imagine your spine is an accordion that has been squeezed shut. As you lift your weight, imagine that accordion lengthening and opening up. Hold that lift for 5 seconds. Breathe out. This lets the discs absorb fluid and takes the direct pressure off the pinched nerves. Then slowly lower yourself back down. When you do this, you create a negative pressure inside the disc. This vacuum effect can help pull nutrients back into the disc and take pressure off the sensitive nerve roots. It is a momentary relief that, when repeated, can help desensitize the area. Do this 2 times before you stand up from your chair after a long meal or watching TV. It resets the nerves before you put gravity back on them. It can prevent that stiff start when you first walk. But please talk to a clinician first if you have shoulder issues, weak wrists, or high blood pressure, as pushing down can spike pressure momentarily. We have talked about aches and pains and how to manage them at home, but we need to have a serious conversation about safety. Pain is one thing, function is another. There are certain signals that mean you need to stop watching videos, stop doing exercises, and call a doctor immediately. If you are walking and you notice your foot is slapping the ground, like you can't control it gently placing down, That is called drop foot. It means the muscles that lift your foot have stopped working. Or if you try to lift your big toe toward your nose and it simply won't move no matter how hard you try. These are not aches. These are signs that a nerve is completely blocked. The signal from the brain is not reaching the muscle. That is a medical emergency. If you catch it early, it can often be fixed. If you wait, it can become permanent. Also, if you have numbness in the saddle area, the groin and buttocks, or if you lose control of your bladder or bowel, that is a major red flag for cauda equina syndrome. These are not wait-and-see symptoms. These are signs of significant nerve compromise, where the bundle of nerves at the base of your spine is being strangled. Don't be a hero. If you lose function, get professional help today. So let's recap the detective work we just did. If the pain is in the groin crease and hurts when you put on socks, it's likely your hip. If the pain is in the buttock, travels past the knee to the foot, and feels better when you lean on a shopping cart, it's likely your back. Check the socks, check the shopping cart, and check the knee barrier. Once you know which one is the villain, you can't just ignore it. You need a specific morning routine to fix it before it locks up on you completely. I have developed a very simple 3-minute bed routine that targets these exact issues. It's the perfect next step to get moving pain-free without having to go to the gym. Now, I want to go a little deeper into the why, because understanding your body is the best painkiller there is. When we talk about the hip joint, we are talking about a ball and socket mechanism that is designed to be incredibly robust. It is the strongest joint in the human body. It is designed to last a lifetime. But modern life is the enemy of the hip. We sit too much. When you sit, your hip flexors, the muscles in the front of that groin crease, get short and tight. They turn into steel cables. When you finally stand up, those tight cables pull your pelvis forward. This tilts your bowl and jams your lower back joints together. This is why a hip problem often becomes a back problem. It is a chain reaction. This is why the windshield wiper exercise is so powerful. It doesn't just lubricate the joint. It gently encourages those tight tissues to let go. It signals to your nervous system that it is safe to move. On the flip side, let's look at the spine. Your lumbar spine is not designed to do the heavy lifting of rotation. Your hips are designed to rotate. Your spine is designed to be stable. But when your hips get stiff, remember the shoelace test? Your body has to find that rotation somewhere else. It steals it from the lower back. Every time you twist to grab something from the back seat of the car, if your hips are locked, you are grinding your spinal discs. You are asking a stability joint to do a mobility job. That is a recipe for disaster. That is why fixing your hips can often cure your back pain. You are stopping the theft. You are letting the hips do the job they were hired to do, so the back can take a vacation. I want you to really think about the groin rule next time you feel a twinge. Is it deep in the front, or is it radiating from the back? This distinction changes everything. If it is the hip, we need to focus on rotation and lubrication. If it is the back, we need to focus on stability and decompression. Let's revisit the knee barrier for a moment, because this is often the most confusing part for patients. They feel pain in the thigh and they panic, thinking it is sciatica. But remember, the femoral nerve, which serves the front of the leg, comes from the upper part of the lumbar spine, L2, L3, L4. It travels down the front. The sciatic nerve comes from the lower part, L4, L5, S1, and travels down the back. If your pain is in the front of the thigh, it could be the hip joint referring pain, or it could be a higher lumbar nerve issue. But here is the telltale sign. A nerve issue in the front of the thigh will often cause numbness or weakness in the knee. Your knee might buckle. A hip joint issue will just ache. It won't make the muscle shut down, it will just make it painful to move. If the pain is in the back of the thigh, it is almost never the hip joint. The hip joint simply does not refer pain to the back of the hamstrings. That is almost exclusively the territory of the sciatic nerve or the hamstring muscles themselves. So, front of the thigh equals maybe hip, maybe back. Back of the thigh equals almost certainly back. This kind of body mapping gives you power. It allows you to walk into a doctor's office and say, "Doc, I have pain in the groin that stops at the knee, and I can't put my socks on." That is a clear, concise history that helps your doctor help you. It cuts through the noise. Let's talk about the emotional side of this for a second. Chronic pain is exhausting. It drains your battery. It makes you irritable. It makes you want to withdraw from the world. When you don't know why you hurt, it is infinitely worse. The unknown is scary. It makes you worry about the future. Will I end up in a wheelchair? Will I need surgery? By performing these simple tests, the thumb test, the shoelace test, the shopping cart test, and the bed test, you are taking control. You are turning the lights on in a dark room. Even if the answer is, yes, I have hip arthritis, that is better than not knowing. Because once you know, you can have a plan. You can do the windshield wipers. You can modify your activities. You can manage it. Knowledge is the antidote to fear, and action is the antidote to pain. I want to remind you of the seated decompression technique. It is so simple yet so effective. But you have to do it correctly. Do not shrug your shoulders up to your ears. Keep your shoulders down and away. Use your triceps to push. And breathe. If you hold your breath, you increase the internal pressure in your abdomen, which defeats the purpose. You need to exhale to let the spine lengthen. Imagine a dry sponge. If you pour water on a dry, compressed sponge, it takes a while to soak it up. But if you squeeze the sponge and let go while it is underwater, it sucks up the water instantly. That is what you are doing to your discs. You are creating that suction effect to hydrate them. And for the windshield wipers, remember the speed. Slow, glacial. If you go too fast, your muscles will tense up to protect the joint. This is called guarding. You want to move slower than your muscles' stretch reflex. You want to sneak under the radar. If you can relax into the movement, you will find that your range of motion increases naturally, without any forcing. So, we have covered a lot of ground today. We started with the terrifying statistic about failed back surgeries. We explored the duplex of the hip and spine. We learned the groin rule and the thumb test. We navigated the C-sign confusion. We used the shoelace test to check for mechanical blocks. We went to the grocery store for the shopping cart test to check for stenosis. We drew a line in the sand with the knee barrier. And finally, we used the bed test to break the tie. You are now armed with a diagnostic toolkit that rivals what many professionals use in their initial evaluations. You have the power to discern the source of your pain. But diagnosis is just the first step. The real magic happens in the daily maintenance. The windshield wipers and the seated decompression are your daily vitamins. They are the small inputs that lead to massive outputs over time. Don't wait for the pain to become unbearable. Start these checks today. Listen to the whispers of your body so you don't have to hear it scream. If you found this helpful, think about the people in your life who are complaining about back pain. Maybe it's your spouse, your sibling, or your golf buddy. Share this knowledge with them. You might save them from a surgery they don't need. And remember, the body is resilient. It wants to heal. It just needs the right environment and the right movement. You are providing that environment by understanding the mechanics. There is one more critical piece to this puzzle. Once you have identified the hip or the back, there is a specific way to sleep that can accelerate your healing by 50%. Most people sleep in a position that twists their hip or torques their spine all night long, undoing all the good work they did during the day. I have a full guide on sleep posture for pain relief that dovetails perfectly with what we just learned. But for now, focus on that morning routine. Focus on the socks. Focus on the groin crease. I mentioned earlier that I have a 3-minute bed routine that puts all of this into a follow-along format. It takes the windshield wipers and combines them with 2 other critical movements to bulletproof your hips and spine before your feet even hit the floor. It is the single best investment of time you can make for your mobility. Click the video on the screen right now to start that routine. Let's get you moving correctly right from the start of your day. I'll see you there.